The whole topic of hemorrhage is near and dear to anybody who served in the military as well as OBGYNs. With respect to the world of pregnancy and OBGYNs, hemorrhage remains as one of the top two killers of women worldwide. And especially in the US or here in Texas, where we deal with still sadly high maternal mortality numbers, hemorrhage is one of the top causes. And fortunately for us, it's a preventable cause of maternal mortality. So this is an area that we feel we can truly have an impact in terms of saving the lives of these new moms who otherwise should be having a very joyous moment with their kids and unfortunately are facing excessive bleeding and sometimes death from it. Until now, a lot of attention with respect to hemorrhage has been focused on treatment. So if you look around, you'll see that there's a lot of initiatives that are aimed rightfully so at stopping the bleeding, tourniquet placement. And when it comes to postpartum hemorrhage, it comes down to using different pharmacotherapeutics, TXA, different balloon agents for tamponade purposes. So a lot of focus has been placed on treatment of hemorrhage, but not so much on the diagnosis of hemorrhage. And if you are in the space of maternal mortality or high-risk pregnancies, one of the fundamental points they teach to you is that timely diagnosis and access to care in itself is going to cut down mortality because you can diagnose the problem earlier and get care earlier. And with respect to the hemorrhage device, this is what we're focusing on. We're not focusing on treatment because there's great products out there that are focusing on that. What we want to do is we want to get this tool out in the space where there's not or limited access to care and have this diagnosis be made in a timely fashion so these women can reach the point of care. To give you an example, there are areas in rural Texas where I practice where a mother may be about 2.5, 3 hours away from a facility that'll give them blood products. They might be about an hour away from a medical facility that even has laboratory services. And in these situations, the mother is at home, she's bleeding, looking at the pad, and really doesn't know if it's time for her to head in or alert somebody to get care. And our goal is to basically go to that patient and help them know when it's time to seek care. And even one life saved is one life saved and helps the mortality numbers overall.